Okay, here we have Tilly. Tilly has had a very bad day. Tilly got run over by a big SUV, and she looks very sleepy, and that's because she's had some very nice pain relief medication, so she's actually just having a little bit of a snooze. But what we wanted to show you is that she, among other injuries, has actually had some nasty bruises to her lungs, so we're just giving her a little bit of help by administering oxygen. And there are many ways that vets can administer oxygen to patients. Very small little patients can go into oxygen cages or oxygen tents, but the bigger patients cannot. And she's quite a big dog. This is a Labrador Retriever. And for this purpose, we have to administer the oxygen via a nasal cannula. As you see there's two little prongs here. This, in fact, is a human nasal cannula. Certain dogs are big enough to have these on their nose, and if they tolerate them well, then it's a good way of administering oxygen. Actually, the oxygen is being pumped from this machine here. This is an oxygen concentrator. This machine makes oxygen. It's very similar to what human beings or people that have pulmonary or breathing problems might have at home to help give them oxygen in the comfort of their home environment. So this tube is going all the way through to this, and we're actually administering oxygen into her nose. For dogs that are not big enough for this tube or don't tolerate it well, or for smaller, we would take a small tube just like this and actually put it up the nose, usually up to about this level, and then attach it to this kind of a tubing and administer oxygen that way. We just thought that we'd just show you this cannula on Millie because she's enjoying her drugs and she's sleeping and she's getting some oxygen, which will make her feel better and hopefully help her lung tissue heal.